Respected principal of the college, resource persons, each and every unit associated with this organization, and dear students. At the very outset, I would like to express my sincere thanks to each and every unit associated with this organization, especially to principal of the college and faculty members. I am directed by the personals to speak on the title Stress Management Through Yoga and Rejuvenation Through Yoga. So, before starting my presentation, I would like to share a Sanskrit shlok from Shvetashwar Upanishad that tells us about the significance of yoga. It's not a complete shloka, it's a small part of that shloka. Na tasya rogo, na jara, na mrityu praptasya yoga ganima shariram. Those who attain their body perfected through the fire of yoga does not have old age, illness, or even death. This shloka from Shvetashwar Upanishad tells a great significance of yoga. So, without wasting time, I am going to start my presentation. Before that, I would like to clear one point. Ladies and gentlemen, we should not link yoga with any religion. We should not link yoga with any religion. We all know that religion is purely based on faith, nothing more than that. But the field of yoga or yoga doesn't it's not based on faith. This has three different characteristics that separate yoga with any religion. First one is yoga is experimental in nature. You will see several research studies published in the refereed journals or reputed journals of the world, which are indexed in Scopus, Web of Science, PubMed, etc. So, yoga is experimental in nature, but religion is not experimental in nature. Second characteristic is yoga is experiential. After practicing different practices, we may feel the output of yoga, we may feel the effect of yoga. And third one is yoga is existential in nature, but we do not have an idea about the existence of any religion, but yoga is existential in the form of different types of practices. Before my presentation, Dr. Vinay presented different types of practices that has existence. Yam, Niyam, Asana, Pranayam, Pratyahara, Dharana, Dhyan, Samadhi. There is a long list. But I am not going to talk about the yoga practices which are not standardized in nature. You will be agree with my statement. In the field of yoga, we are lacking in standardization. I will talk on the basis of a standard literature, on the basis of a traditional literature, but time to time, different individuals, different eminent personalities infused their own views, own thoughts in the field of yoga, but I am not discussing about these thoughts. I am going to discuss about that views as per standardized literature. I divided this presentation into different parts. I divided my presentation into different parts. It's not working. Yes, I divide my presentation into different parts for better communication as a symptom of a good health. But at that time, I mean in the year 1948, WHO included only 3 dimensions: physical, mental, and social. But later, WHO realized that this definition is incomplete in sense, and instead of 3 dimensions, physical, mental, and social, WHO included 2 more dimensions, that is emotional and spiritual development. We are discussing about the concept of health. Since there is a long distance in between, so a sensor is not working. Sorry for that. I will stand here and I will deliver my lecture. I have discussed about the concept of health as per WHO, World Health Organization, defined in the year 1948. But later, WHO included 2 more dimensions. I have said earlier also, spiritual development as well as emotional development. So, without attaining these 5 dimensions, we cannot think about stress management, physical, mental, social, spiritual, and emotional development. One more definition from Sushruta Samhita, from the field of Ayurveda, from the field of yoga, I would like to share with you. That is Sama Dosha, Sama Agnisha, Sama Dhatu Malkriya, Prasanna Atmendriya Man, Swastha Itta Bhitiyate. This definition in the Sanskrit language from Sushruta Samhita, from the field of Ayurveda, tells us about the different types of balances. These balances are required to attain optimal health. Let's discuss one by one. First one is Sama. Sama means a balanced state. Sama dosha, our body has 3 different types of defects. As per Ayurveda, Vata, Pitta, Kapha. Balance is required in all these 3. Sama dosha, Sama agnisha. We know that in physiology, we study that the body temperature is regulated by the largest gland of the body, that is the liver. But in yoga, it is mentioned that heat is produced in our stomach. And there should be Sama dosha, Sama agnisha. It means the production of heat should be optimal. If it will be more than normal, we will have the defect of acidity. If this will be lower than the optimal, our digestion will be sluggish. So we have discussed about the 2 different types of balances, Sama dosha, Sama agnisha. Sama dhatu. The word dhatu means elements. Our body is constituted by 7 different types of elements: Ras, Rakt, Mas, Med, Asthi, Majja, Shukra. The balance is required among these 7 elements. Also, we have discussed about the 3 different types of balances: Sama dosha, Sama agnisha, Sama dhatu, Malkriya. The excretory system should work at the optimal level. Passing of stool should be proper, passing of urine should be proper, passing of sweat should be proper. Prasanna Atmendriya Man. This is the spiritual part of this shloka. All 3 should be happy. Our mind, our soul. Soul is a drop of that cosmic consciousness that enters in our body and we are alive. And our senses should be happy. All these 3 should be happy. Our senses, our mind, and our soul. It's a symptom of a good health. We are mature enough. We have enough vision. We can compare the 2 different types of definitions. One is given by WHO, another is given by Sushruta Samhita from the field of Ayurveda. So, yoga fulfills all. Please try to keep in the entirety of our mind. Yoga fulfills the minimum requirement of both the definitions which are required for optimal health. So, I will proceed to the next part of my definition. As I have said, there are 5 dimensions as per WHO: physical, mental, social, spiritual, and emotional. It is not possible to discuss about all dimensions in the limited duration of time. I will cover only one aspect, that is mental health. Since mental health has a significant relationship with our stress. If our mental health is not up to the mark, that will lead to production of stress. So, mental health is also a balanced state. Then the question arises in our mind, what type of balance is required? It is a balance between self and an environment. There is a long list of the variables. There is a long list of the factors which play a vital role in maintaining this balance in between self and environment. If we are able to accommodate ourselves with the environment, there will be no stress. If we will not be able to accommodate ourselves with the stress, that will lead to stress. And there are several factors: psychological factor play a role, social, cultural, spiritual, and so on. There is a long list. These factors play a vital role in maintaining the balance between self and environment. Next, third part is related to stress. Then the question arises, who first time defined stress? When this terminology came in existence? So, first time, if we talk about the definition of stress, it's also a non-adjustment. It is a non-adjustment in the changing situation. Always in our life, the situation changes. If we accommodate or we adjust to that changing situation, that will lead to no stress. If that non-adjustment of ourselves with the changing situation is known as stress, and We can say that it is a imbalance between the different dimensions of health, and we have discussed earlier about the different dimensions of health: physical, mental, social, spiritual and emotional. First time, endocrine specialist from a Canadian, Dr. Hans, defined stress, and in his words we can say that it is an improper response of the body to any demand made upon it. If any situation made any type of demand on our body, if that is non-specific in nature, that is the condition of stress in the language of Dr. Hans. And the next part, this is the most important part of my presentation. Ladies and gentlemen, body and mind cannot be separated. If anything happens in our mind, that essentially affect our body. If anything happens in our body, that essentially affect our mind. Both are affected by each other. Body and mind cannot be separated. So I will discuss in detail about this connection between body and mind. And I have gone through an article, and the name of the article was Challenging and Changing Stress Producing Thinking. The article was written by Phyllis E. Miller in the year 2001, and the article is published in or indexed in PubMed and PubMed Central. And we know that PubMed and PubMed Central is a reputed name in the medical sciences. So this article has a great impact. So a patient had a severe adverse reaction to the medication prescribed by the doctor. Patient came to the doctor, doctor gave the medicine, but there were adverse effects in this hypothetical example. So the doctor was flooded with thoughts. Why? Since there were adverse reactions to the medication given by the doctor. That was not expected by the doctor. So I will discuss about two different situations. First situation comes under the category of stress producing thought process. Situation is the same. Individual became ill, visited doctor, doctor gave medicine, but there were adverse effect of that medication. See this picture from top to bottom. We will discuss and we will conclude something on the basis of this picture. There was an assumption. See the assumption, I must be perfect all the time. That was the assumption of a doctor. I never commit mistakes. I am ultimate in nature. I am perfect doctor. That was the assumption of a doctor. And doctor committed an error. Wrong medicine was given by the doctor, and escalation takes place. I should have known. I should be sued. I am incompetent. These types of thoughts arise in the mind of the doctor, and feeling started, headache started. The doctor was full of shame. Doctor started taking alcohol, and doctor avoided or blame avoidance, and the behavior changed. This is a hypothetical example given in that article that comes under the category of stress producing thought process. Situation is same. Next situation is that is based on evaluating thought process. Again I repeat, situation is same. Wrong medicine was given by the doctor, and there were adverse effect of that. What was the assumption of the doctor? See this picture from bottom to top. What was the assumption? There was a healthy assumption. I am not perfect. I sometimes make errors. That was the assumption of a doctor. Every individual is bound to have some error. So I can also commit errors. Nobody is perfect in nature. Nobody is ultimate in this universe. That was the assumption. But the assumption of in the first situation, that assumption was I am perfect. I never commit mistakes. If we assume in this way, there will be possibility of stress. See the situation. Doctor committed mistake. Doctor committed mistake means wrong medicine was given by the doctor. Feeling started. See in this picture, I am uncomfortable. That doesn't mean I am incompetent. These types of thoughts arise in the mind of the doctor. Physical symptoms appeared, but doctor focused. Doctor requested colleagues, and doctor has taken the help from the colleagues, and behavior changed. We can conclude on the basis of these two thought processes. Again, I repeat, first thought process is based on stress producing thinking. Second is on the basis of evaluated thought process. On the basis of that, negative thoughts can deteriorate. We should keep in our mind negative thoughts can deteriorate person's mental health, not only person's mental health, physical health, and this affect our professional relationships also, not only professional relationships also, that affect our personal relationships, relationship between child and a parent, relationship between husband and wife, relationship between brother and sister, and on we can say that affect our decision making ability also, the power of taking decisions. The individual suffering from stress will not be able to take good decisions in his or her life, and we know that the behavior also changes. So we have discussed about the different types of thought process. It means related to stress, everything depends on our thought process. We can conclude that we should have healthy thought process based on evaluating thought process. Now, in the fourth part of my presentation, I will discuss about the association of yoga with the thought process. We know that related to stress, everything depends on our thought process, and yoga is related to thought process. You will find different definitions in the field of yoga. In Vedas, it is written that to become from the cycle of birth and death is known as yoga. In Upanishad, it is written that to achieve unachievable is known as yoga. In Bhagavad Gita, it is written that to become stable in the ups and downs of the life is known as yoga. But I am talking about the definition given by Maharshi Patanjali in Yoga Sutra in the form of a Sanskrit shlok. Yoga is a cessation of the thought. Cessation means to stop. Yoga is a cessation of the thought waves of the mind stuff. Cessation means to stop. Thought waves means in the language of yoga we can say that vratis, thought waves. To stop the thought waves which are originated from our mind stuff. Then the question arises, what do you mean by mind stuff? Mind stuff means the entirety of human mind is known as mind stuff. We can compare a hard disk of the computers. Everything is stored. Basically, everything is stored in the depth of our unconscious mind. We do not have an idea what is stored in our mind, but that effect. So, in the language of yoga, cessation of the thought waves of mind stuff is known as yoga. If we will be able to stop the wandering mind, then nothing else. We can manage stress. Since we have discussed in the earlier discussion, everything depends on our thought process. So we should have a deep idea about the mind stuff also. Till now I have discussed that mind stuff means the entirety of human mind. In the language of yoga, that is known as chitta. That is a cosmic mind. That is a small drop of cosmic consciousness. That is all pervading. That is noticeable everywhere. That is known as cosmic mind. In the next part of my presentation, this is the most important part of the presentation, the link between physical and mental health. I have said earlier also, body and mind cannot be separated. If anything happens in the mind, that essentially affects our body. If anything happens in our body, that essentially affects our mind. We will discuss about these relationships. How? See, link between physical. Important is there are inseparable links between mental and physical health. I have said earlier also, several times I have repeated. I would like to share a report, the contents or the small or extract of a report of WHO, World Health Organization. More than 100 million people suffer from mental health disorders in the Western Pacific region. Out of all mental disorders, depressive disorders alone are responsible for 5.73% of the total diseases. See the effect of this. We were discussing about the body-mind connections. There are two different types of connections. One is automatic. We cannot control. Automatically that happens. We cannot control that. And this automatic body-mind connection may occur in two different ways. First one is from mind to body phenomena. Second one is automatic body to mind phenomena. Second type of body-mind connection is a deliberated connection. And this deliberated connection may occur in two different forms: deliberated mind-body expression and deliberated body-mind expression. So we will discuss about all four types of connections. Two comes under the category of automatic and two comes under the category of deliberated, one by one. Again I repeat, first one is automatic mind-body phenomena, second one is automatic body-mind phenomena, third one is deliberated mind-body expression, and fourth one is deliberated body-mind expression. Let's discuss one by one. To know a deep idea about the body-mind connections, let's start with the first, that is automatic body-mind phenomena. I listed few. Examples are crying. The initiation starts from the mind. That affect our body also, crying, laughing, facial expressions also, body language also, this one, emotions, our emotions, and cognitive, any type of cognitive activity, that comes under the category of automatic mind-body phenomena. Next one is hypochondria. This is a several people in the society, it is revealed by the research studies, several people in the society are suffering from this hypochondria. The initiation started from mind. We are not suffering from any disease and we believe that, yes, I am suffering from diabetes. Really diabetes occurs. That is known as hypochondria. Initiation starts from mind. Next one is psychosomatic disease, and we all are, since we all are from academic pursuits, we know and we conduct researches also. Since we are associated with the research, we know the placebo effect. The placebo effect also comes under the category of automatic mind-body phenomena. Next one is automatic body-mind phenomena. Initiation starts from the body, that refreshes our mind. Simple examples I have included that. Physical pain, any type of pain, maybe, and pleasure also. Our body take pleasure, that refreshes our mind. And examples are the examples of pain are heat, cold, internal pain, joint pain, and different types of pains. In the category of physical pleasure, examples are food. If we eat good food, that refreshes our mind. Next one is bath. Our body take bath, but that bath, physically we take bath, but that refreshes our body. It's a truth. That comes under the category of automatic mind-body phenomena. There are several types of pleasures and go on. Next one is deliberated mind-body expression. Deliberated body-mind expression means body-mind practices are there, as well as acting is there. And in the category of body-mind practices, imagery practices, autogenic practices. Now, one word from the field of yoga came here, that is meditation. Meditation is one limb out of 8 limbs of yoga: yam, niyam, asan, pranayam, pratyahar, dharana, dhyana. Meditation comes under the category of deliberated mind-body expression. So, this comes under this category, but we should know that since body and mind cannot be separated, we perform by the involvement of our mind, but that essentially affect our body. Next one is biofeedback, and last type of connection is deliberated body-mind phenomena. All pranayama practice, Dr. Vinay explained about pranayama also. Pranayama is also one limb from all 8 limbs. That comes under the category of deliberated mind-body phenomena. Physical exercises, or since we all are associated with the field of physical education, we do physical exercises also and we practice also asanas. Both physical exercise, maybe circuit training, weight training, fatigue training, pressure training, resistance training, all comes under the category of deliberated body-mind phenomena. And in the field of yoga, asanas, yoga asanas may be performed in standing position, maybe in sitting position, maybe in prone lying position, maybe in supine lying position. And the next one is progressive relaxation technique. Now, there is a trend of practicing progressive relaxation practice for relaxation purposes to avoid stress. In brief, we can say that in progressive relaxation technique, first we contract the muscles and we concentrate on that contraction. Then we relax our muscles and we concentrate on that relaxation of muscles. And in the third phase of this progressive relaxation technique, we try to differentiate in comfortable posture, we try to differentiate between the difference between contraction of muscles and relaxation of muscles. This is the way, this is the practice of progressive relaxation technique. Next one is spiritual perspectives. It is the most important part, spiritual perspectives. We have discussed earlier also that if any type of imbalance takes place between 5 dimensions, physical, mental, social, spiritual and emotional, that will lead to stress. So spiritual perspectives in our yogic literature, it is mentioned that there are 72,000 nadis in our body. What do you mean by nadis? Nadis are micro vessels where the prana flows. We know about the circulatory system, arteries, veins, venules, arterioles, and thinnest are the capillaries where the blood flows. Simultaneously with this circulatory system, simultaneously with this blood flow, one more system works, that is known as system of nadis where the prana flows. And prana is a vital force, due to that we are alive in nature. And out of 72,000 nadis, 3 are main, Ida, Pingala, Sushumna. In layman's language, we can say that Ida is our left nostril, and this Ida nadi has cold effect. Due to its cold effect, this nadi is known as Chandra nadi. Important point is, this nadi is responsible for the functioning of our excretory system. Our excretory system is controlled by this Ida nadi. If any defect exists in our excretory system, we take antibiotics, but the root cause is the defect of Ida nadi. Second Pingala nadi, in layman's language, we can say that Pingala nadi is our right nostril. This has warm effect, and warmness is denoted by Surya. Due to its warm effect, this nadi is known as Surya nadi. We have discussed that Ida nadi is responsible for which system? I am not testing you. Ida nadi is responsible for which system? Excretory system. On the other hand, Pingala nadi is responsible for the control of 2 major systems, respiratory system and circulatory system. For the optimal functioning of all these 3 systems, 1 belongs to Ida, 2 belongs to Pingala. That is excretory, respiratory, circulatory. Balance between Ida and Pingala nadi is required. Without maintaining the balance, we will not be able to attain a optimal positive health. And this balance takes place by the help of third nadi, that is known as Sushumna nadi. That is the junction between these 2. So we will discuss in very brief how this balance between Ida and Pingala nadi is maintained by the help of Sushumna nadi. That takes place by the help of body chakras. We have discussed about nadis. Nadis are micro vessels where the prana flows. Chakras are energy centers. In our body, different types of energies are produced. From bottom to top, there are 7 chakras: Mooladhara, Swadhisthana, Manipur, Anahata, Vishuddhi, Agya and Sahasrara. There are 7 energy centers in our body. It means 7 different types of energies are produced by the body. And if we talk in the language of anatomy, this Ida nadi, this Mooladhara chakra is situated at the root on the sacral bone, or at the Mooladhara chakra, or we can say that in layman's language, we can say that is at the opening of anus. And second one is Swadhisthana, situated at our sexual organs, or we can say that on gonads. Next one is Manipur chakra. Manipur chakra is situated at our stomach, or we can say that near to our adrenal gland or pancreas. Next one is Anahata chakra. Anahata chakra is situated at our chest region, or we can say that situated at our heart. Next is Vishuddhi chakra. Vishuddhi chakra is situated at our neck region, or we can say that that is situated at our thyroid gland. Next one is Agya chakra. We can say that Agya chakra is situated at in between our eyebrows, or we can say that that is situated at our largest gland of the body, that is known as pituitary gland. Last chakra is Sahasrara chakra. That is situated at our vertex, or we can say that that is situated at our smallest gland of the body, and the smallest gland is pineal gland. Ladies and gentlemen, dear students, we are discussing about the maintenance, how to eliminate stress. For that, we are discussing that takes place by the help of by maintaining the balance between Ida Pingala nadi, by the help of Sushumna, by the help of chakras. How many chakras are there? 7 chakras. that takes place by the help of the activation of Kundalini. After discussing about two terminologies, that is nadis and chakras, one more terminology is in front of us, that is Kundalini. Kundalini is spiritual energy. We all are born with this spiritual energy. In inactivated state, this resides in the Mooladhara chakra. This resides in the sacral bone. That is the last part of our spinal cord. And if we compare with the physical remains, this is having like a rope or a snake having 3.5 rounds, and each round has a specification. First round is responsible for Sattva, second is for Rajas, and third one is for Tamas. And after activation, through regular practice, there are various means and methods by using that we can activate our spiritual energy in the field of yoga. Raj Yogi, by the help of meditation practice, do the same. Tantra Yogi, by the help of Tantra Vidyas, do the same. Hatha Yogi, by the help of asanas and Surya Namaskar, do the same. Sahaj Yogi, by the help of Sahaj Yoga, do the same. There are various means and methods by using that we can activate this spiritual energy, and expansion of consciousness takes place, and the individual leads to self-realization, and we can avoid stress. This is the spiritual perspectives. One more concept, already this concept has been explained by Dr. Vinay, but I am explaining in another way. So there are after hearing the word this Kundalini or sacral bone or spiritual energy, we should not be surprised. See this diagram, see this photo, the last part of that is known as this is known as holy bone. So, and we should not link with any religion. This concept was present at the time of Hippocrates also, in the year 400 BC. This was known by Henostown. This concept was present in Roman people also, that was known by sacred bone. And why this bone is known as holy bone? Yogis discussed. Few believes that since this is responsible for our rebirth, few believes that since this protect our genital organs, but the last decision was taken by the yoga experts. Since this is responsible for our rejuvenation, so this is known as holy bone. And I have taken few examples from different literatures. In Muslims, there is a literature, hadith, written by Abu Hurairah. It is mentioned in almost all religions, in Hindus, in Christians, in Muslims also. I have taken one example. This bone, by this bone, I mean this sacral bone, this cannot be destroyed. Allah will make a new body by the help of this. Words may be different, and I have taken this from an article that was published in the year 1982, that was published in the American Journal of Medical Association. And one example I have taken from this hadith written in the year 1991 by Sahih al-Bukhari. So concept of body layers, Dr. Vinay explained about this, but I will throw few, light on this also. We have 3 different types of bodies. You will be agree with my statement. We spent most of the time of our life to glorify this physical body only. Physical body means that is known as Annamaya Kosh. Birth takes place, development takes place, stagnation takes place, deterioration takes place, and the death takes place. This is an example of physical body. And we do weight training, aerobics, different types of practices to glorify this body. Ladies and gentlemen, our development, the development of human being depends on remaining 2 layers. There are 3 layers we should keep in our mind. Second layer is known as astral body. Astral body means, in language of yoga, that is known as Sukshma Sharir, astral body. That is connected to the physical body with a subtle thread. When cut, that departs the body. And this has 3 sub-layers: pranic shat, mental shat, and intellectual shat. We are discussing from the point of view of stress. Since this layer, this middle layer, that is known as astral body, has a great relationship with our stress. First, pranic shat, that controls or that experience our sensory organs. Heat, cold, hunger, thirst. But this mental shat, that is known as Manomaya Kosh, that is associated with the production of stress. What does it mean? Our thoughts are controlled by this. doubts, exhilaration, depression, and delusion. Since these five terminologies are associated with all these five terminologies, we know that all these five terminologies have a great association with stress. So we should strengthen our this mental shaft, and intellectual shaft means that controls and guides our mind. Our mind work under the direction of this, and discrimination, what is right, what is wrong, that is decided by our this intellectual shaft, and our decision making depends on this. Last one is the main, that is a causal body. Dr. Vinay explained that that is a Karana Sharir, causal body, that is a seed body. Our karmas are stored in the depth of our unconscious mind in the form of a seeds, blueprint of a plant, and it will produce the same that the stores. These are the subtle impressions in the form of our karmas. So we can say that everything depends on our karmas. Social perspectives, since limited time was assigned to me, I will talk in very brief. What does it mean? What do you mean by social development? It is also one main dimensions of the health. If I ask three questions from you, is friendship possible between two persons who speak more? Is it possible? Yes or no? Suppose there are two people and speak very much. Is it possible? Yes or no? Please see this question. Is friendship possible between two persons who speak more? Who will listen? Not possible. Second question is friendship possible between two persons who speak less? No. Is friendship possible between two persons where one speak less and one speak more? Yes. Why? There is a principle in the field of physics. Opposite poles attract each other. Same is applicable in social perspectives. Opposite poles attract each other. This is the social. We have to accommodate with each other. So what to do? This is known as opposite pole means, this opposite pole means our fundamental behavior that depends on our nature. Sometimes we say she is having a good nature, he is not having a good nature. What do you mean by good nature? That our nature depends on fundamental behavior. So what do you mean by fundamental behavior? And there is a significant effect on our fundamental behavior by the help of yoga practices. So we should have an idea, what do you mean by fundamental behavior? Our fundamental behavior changes by practicing yoga. This consists of three, that is inclusion, control, and affection. All these three traits, all these three characteristics that belong to fundamental behavior, present in two different forms, expressed and wanted. Ladies and gentlemen, we express very less and we want more. This is the trend in the society. Again I repeat, we express nothing and we want something. It's not possible. We have to accommodate between these. It means there are 6 states. Expressed inclusion, wanted inclusion. Expressed control, wanted control. Expressed affection, wanted affection. So by the help of yoga, please try to understand my sentence. By the help of yoga, we accommodate, we adjust our wanted inclusion, wanted control, wanted affection as per the expressed inclusion, expressed control, and expressed affection of individual. So this happens by practicing yoga, by pranayama, by meditation, by Sahaj Yoga meditation, by transcendental meditation, by prana dharana, concentrate on the breath. There is a long list of practices. So in the next part, that is stress and performance. If I ask how to eliminate stress, can we eliminate stress? Yes or no? No, we cannot eliminate stress. No one in this universe can eliminate stress. But we have to convert in eustress. Stress has 2 different types. Stress that is negative, eustress. One is distress, another is eustress. Since low pressure, performance is very low. In case of optimal moderate to high pressure, the performance is optimal. So optimal level of stress is required to excel. No one in this universe can excel without optimal stress, but it should not be converted into distress. We should maintain within the eustress range. Now the last part of my presentation, it is very difficult to practice different presentations. One expert from before me explained about the micro exercises in Hindi. He called Sukshma Vyayam. I will suggest few practices. Why I included these practices? These practices can be practiced anywhere, by sitting on the chair, during walk also, anytime. See, these practices are, see, first one is Kapol Shakti Vikasak. First one is Kapol Shakti Vikasak. Kapol, what do you mean by Kapol? Kapol is our cheeks, to glorify our cheeks. But as per researches, this Kapol Shakti Vikasak comes under the category of micro exercises that glorify our cheeks, but simultaneously with the to glorify our cheeks, this strengthen our lungs and this rejuvenate ourselves. Resilience takes place. See this practice. Please click on this. First one, click on first one. First. This is first, second, third, fourth. First one. See the Kapol Shakti Vikasak. How to perform this Kapol Shakti Vikasak? See. Bring your fingers together. By the help of this thumb, we control the nostril, and we have to inhale through mouth. After full inhalation, after deep inhalation, bring the fingers on the chest, tuck the chin, come in the position of Jalandhar Bandh and maintain the position. This is the Kapol Shakti Vikasak. Kapol means cheeks. Kapol Shakti Vikasak comes under the category of micro exercise. Next one is Nasagra Drashti. Nasagra means our nose tip. I will give you this presentation to you all. If you want to practice, you can see in this video also. Next one is Nasagra Drashti. Drashti means vision. Nasagra is a Sanskrit word that means nose tip. Please click on the second one. On that video. This is a touch screen. Click on that. No. Directly touch on the screen. Directly touch on the screen. This one. Third, fourth. Okay. Yes, this one. What one? Okay, I will explain without this. Nasagra Drashti means keeping the eyeballs on the nose tip. Keep eyeballs on the nose. This practice is known as Nasagra Drashti. Third one is Bhru Madhya Drashti. Bhru means eyebrows. Keeping your eyeballs in between the eyebrows. That is known as Bhru Madhya Drashti. These are the three practices. Comes under the category of micro practices. Please. Next is Anulom Vilom Pranayama. We have discussed about, please wait. Prana Dharana. Prana Dharana means concentrated. There are different types of meditation. Simplest type of meditation is known as Prana Dharana. In layman's language, Prana means our respiration. Concentrating on the prana, concentrating on the breath is known as Prana Dharana. Next one is a meditation. There is a long list of meditation practices: Sahaj Yoga meditation, transcendental meditation, concentrative meditation, mindfulness meditation. There are different types of meditative practices. So, I tried my level best to explain about the basic concepts of how spiritual development takes place, how social development takes place, how we cannot eliminate stress, but we have to convert in eustress instead of distress. So sincere thanks to all of you also for cooperating me. Thank you very much. Again, I express my sincere thanks to
Gentlemen, so we have the last session before the lunch, and there is